The Nigerian Institute of Medical Research (NIMR) and other stakeholders in the country have launched the Canada-Africa Mpox Partnership (CAMP). The news agency of Nigeria reports that the project is in partnership with the Canadian Institute of Health Research and the International Development Research Centre. According to the stakeholders, the project aims to curb the spread of mpox and study the dynamics of human transmission. During the unveiling of the project, Professor Babatunde Salako, the Director General of NIMR, said Nigeria would work with their Canadian partners to help inform the clinical and public health response to local and global epidemic of mpox.
It will provide needed information for stakeholders in the project that is being planned. And the stakeholders include not just other researchers, but also the community who will be participating in the projects, such that they will be part of the project from the beginning. And therefore, if at the end of the day there is a very useful result that can be translated to the community to improve their health status and the health system, it will not be difficult for them to take it on or imbibe it.
The DG, however, reiterated the need for a medical research council to fund research works peculiar to Nigeria. Professor Rosemary Audu, the principal investigator of CAMP Nigeria, said the central components of the CAMP project were multi-directional capacity building and community engagement.
So the broad components of the CAMP project in Nigeria is to assess the burden of monkeypox disease and mpox virus infection, as well as the transmission dynamics in Nigeria, to investigate the role played by domesticated and wild animals in the maintenance and spread of monkeypox virus to humans in Nigeria, and then also to assess the knowledge, awareness, and willingness to accept mpox vaccines among Nigerians. So it's a multidisciplinary project, and the objectives are three main objectives for the big group. That is, characterize and compare monkeypox transmission dynamics in Canada and Nigeria, evaluate the role of the antiviral teproviral in treating human monkeypox infection, and evaluate the role of the Imvamune vaccine in preventing human monkeypox infection.
These are some key goals that this project intends to achieve at the end of the project. The first goal is that we want to understand, as we said earlier, that different gaps in the transmission of monkeypox. So one of the key goals is to understand the transmission dynamics and compare this goal with what happens in the Canadian counterpart. So that's the first goal, understand the transmission dynamics. The second key goal is we want to use this understanding to develop countermeasures, be it clinical or public interventions, to counter the transmission of the monkeypox virus. Now, the third thing we want to do is, when it comes to clinical countermeasures, the use of drugs and vaccines, we want to understand the effectiveness or efficacy, as the case may be, as well as the safety of the use of therapeutics such as teproviral and vaccines such as Imvamune in the treatment and prevention of monkeypox, as the case may be. And then the fourth goal is also to understand from the community perspective, how do they view monkeypox as well as monkeypox vaccines. And lastly, we want to see how through this partnership we can build research capacity and preparedness for future outbreaks.
The other institutions in the project are University of Ilorin, Slum and Rural Health Initiative Network, Institute of Human Virology in Nigeria, and Maryland Global Initiative Corporation.